Well, every year, the federal government spends $4 billion of your money fixing medical errors and mistakes that happen to people on Medicare. 27 Investigates reporter Amanda Smith dug into the court records to learn how local people have been hurt by the hospitals they trusted to heal them.
We'll call her Jane. 2 years ago, this mother of three experienced such severe pain that her gynecologist recommended surgery. She asked us to keep her identity confidential. She currently has a lawsuit pending in Mahoning County Court and did not want to compromise her legal case.
My purse is a pharmacy. Pills to stop me from losing my bowel.
She didn't know this routine surgery would be the start of what she calls a living nightmare.
They did the hysterectomy. When it was time to pull the tubing out, as my understanding is when they nicked the bowel.
To repair the injury, doctors removed 7 inches of her bowel, which had been healthy. She says the pain when she woke up was indescribable.
It was more than I could handle. It was horrible. I wouldn't want nobody else to go through that, ever.
When it comes to medical errors, Jane is not alone.
There is a significant amount of people who die every year or are permanently injured in some way from medical errors.
Pamela Pentagis is a medical malpractice lawyer. Last year, she represented the family of a woman who died after doctors at one local hospital put a breathing tube into her esophagus instead of her airway.
Unfortunately, it is a problem in this country, and families need to know about that and need to know what to do.
The hospital and doctors settled out of court, and the family is barred from talking about their experience.
The federal government calls these mistakes adverse events, and they're required to be reported. But a recent study shows that less than 1% of them actually are. Now, unless the victim or their family file suit in open court, you may never hear about it at all.
The OIG is now calling for a national system to track malpractice, as Obamacare adds health insurance for millions of people. The fear is mistakes will increase too.
This is an issue, and I think will continue to be an issue if we don't have the proper definition of adverse event and what needs to be reported according to the current code.
Laws vary from state to state. In Pennsylvania, hospitals report malpractice events, but these reports are kept secret by law. In Ohio, some errors have to be reported. But when I asked for these records from the State Department of Health, I was told this is something that ODH does not collect, even though it's mandated by Ohio law. Advocates say that needs to change.
To understand what's their performance level, what's their error rate, what's their problem rate. I think that's something we as consumers have the right to know.
John Palmer with the Ohio Hospitals Association says current methods of reporting are adequate.
There's been a lot of focus nationally on healthcare performance and with hospitals really trying to address the reduction of harm.
As for Jane, she's facing yet another surgery.
I am going to see a different doctor, but he doesn't do any other surgery except the same hospital where I had the first surgery, and it makes me nervous to go there. I'm scared to go there. I don't want to go there.
In Youngstown, I'm Amanda Smith, 27 Investigates.
For more of this story, you can go to our website, WKBN.com.